Hello guys, welcome to my channel Pajon Imaging Hub. In today's radiographers and other health professionals series, we look at diagnosis of pneumonia in chest X-ray, how you can make the diagnosis very easily. Please remember to like, share and subscribe to my channel so that you'll be notified when new video is released. Welcome back. So, what is pneumonia? Pneumonia is an infection of the lung caused by bacteria, virus, or fungi. Pneumonia is not a common cold. Pneumonia can be classified by etiology, setting of infection, method of spread, and the radiographic appearance we see in chest X-ray. We can use any of these things to classify pneumonia. Now, based on etiology, we'll talk about bacterial pneumonia, we'll talk about virus pneumonia, we'll have a fungal pneumonia. Then we'll have this last one, protozoan pneumonia. Toxoplasma, though rarely, has been seen cause pneumonia. We'll talk about method of spread. Bronchopneumonia. Bronchopneumonia spreads through the small air sac, that is the alveoli, and the bronchi, that is the airway. And then it fills by filling it with pores and fluid. Lobar pneumonia. Some of the pneumonia occupies a lobe or part of the lobe. Then we have interstitial pneumonia. Interstitial pneumonia spread between the air sacs of the lungs or the lung interstitium. So these are the classification of pneumonia based on method of spread. Then we'll have classification based on setting of infection. We'll have the community acquired pneumonia. This is pneumonia gotten outside of a healthcare facility, like in where you are living that is not hospital. Then we'll have a hospital acquired pneumonia. This is pneumonia gotten while in a hospital or healthcare facility. This is a kind of a nosocomial infection where you come to hospital, you get another disease that you did not come with. And we'll have a ventilator-associated pneumonia. People that are placed in ventilator, they tend to have this kind of pneumonia. Then we'll have lipoid pneumonia. Lipoid pneumonia, this is a form of pneumonia associated with the presence of oily stroke lipid in the inflamed part of the body. This could be from aspiration. If you aspirate oil, maybe mineral oils or something like that. Also, in setting of airway obstruction, the obstruction results in the accumulation of debris of cellular breakdown, which include cholesterol from destroyed alveolar walls. Now, these lipids are difficult to digest, and the macrophages, which attempt to phagocytose them, accumulate within the alveolar space. So this is a kind of lipoid pneumonia. Those macrophages, they find it difficult to digest those accumulated fatty particles. So that can give rise to infection that stays there. We'll have aspiration pneumonia. Aspiration pneumonia is due to inhalation of foreign material such as food, solid or liquid, into the lung. When these are not coughed out, the lung can be infected, and that gives rise to pneumonia. Then we can equally classify pneumonia based on radiographic appearance, what we see in the X-rays. We have the atypical pneumonia. Atypical pneumonia describe unusual pneumonia where there is unusual clinical presentation of the pulmonary infection for which a specific causative organism was not recognized. Is unusual. Then it equally gives atypical clinical and radiographic features. Then the other one is round pneumonia. Round pneumonia primarily is seen in children and is characterized by a round or spherical opacity in the chest X-ray. You will see the opacity to be in round form. Then we have cavitating pneumonia. It is a complication that can occur with severe necrotizing pneumonia. Some people call it necrotizing pneumonia. The radiographic sign is subtle area of radiolucency superimposed on a region of consolidation. So you see a cavity that contains air fluid level. That is a sign of radiographic sign of cavitating pneumonia. The other one is hemorrhagic pneumonia. Hemorrhagic pneumonia shows radiographic features of diffuse, mainly bilateral alveolar opacification, often with a central and lower lung distribution. Though depending on extent of the bleed, radiology sign is not definitive, but in this case, it helps in the evaluation or assessment of the patient at that period. Let's look at the radiographic signs and features of pneumonia. What do we see in chest X-ray? Now, the two main radiographic features are air space opacification and air bronchogram. This is the two major signs that help to identify that a patient has a pattern suggestive of pneumonia. Other ones are derived from these two major features. The other ones are pronounced bronchovascular markings because there is an increase in blood flow because of the infection to the lung. Then fluid buildup is seen also. Heart borders obscuration, like what we call it the CH sign. Then spine sign. Then we have the reticular opacities, the mesh like that. It appears like mesh-like opacities. The spine sign is a sign that in spine, as you go down the spine from the cervical or upper thoracic to the lower thoracic that you see in the chest X-ray, it is expected to increase in lucency or darkness. So, but when all of a sudden you start seeing increase in opacity instead of darkness or lucency, then it implies something is abnormal. We also have a pleural effusion can equally result because of accumulation of fluid, which tend to put together and form effusion. There's some complications of pneumonia that we see for a long-standing, aggressive or severe pneumonia. The example include pulmonary abscess. Um, we see accumulation of abscess, the empyema, accumulation of pus, pockets of pus here and there. Then empyema necessitan is a serious complication of empyema where infected pus from the pleural space spread into the chest wall and surrounding tissues. We also have pneumotocele. This is a cavity in the lung parenchyma filled with air that may result from pulmonary trauma during mechanical ventilation. These are complications we see in pneumonia. The other one is bronchopleural fistula, where there can be a connection, abnormal connection between one part of the bronchus to the another part in the lung. Let's look at this image. This is a normal lung section of the lung that contains the bronchiole and the alveoli. You see this sliced alveoli. You can see it is open. It contains air. There is nothing there. Is empty. You see the bronchiole is also empty. But down here, the pneumonia one, you see it is occupied with pores. You see it's occupied with pores, both the bronchiole and the alveoli. These other two images down here, I want us to understand it very well because that form the basis of the mnemonic changes we see in chest X-ray. Like here, there is one previous video I made. I was trying to explain air bronchogram. I could not get a good image, but this clearly shows air bronchogram. Then this one is opacified alveoli and bronchi. There is no air bronchogram in this one. So let's look closely and understand this air bronchogram. It will help you in understanding how these things work. Is opacity. Now inside this opacity, you see this line, that line, this line, that is air in the bronchiole. But areas, these other areas that look like cotton wool, is the alveolar that is occupied by fluid or pus or anything. So you see that the alveolar, which is the end of the bronchiole, are occupied by pus, but the bronchiole are still open and contains air. That is what we call air bronchogram. It shows that this person has a alveolar disease. This one, you see the opacity. You cannot make out any line, any dark line through it. So in this case, it's a section of the lung that I cut. In this case, both the bronchioles and the alveoli are occupied with pores of fluid, so we could not make out anything. So it is just the opacity that we are seeing. So this is a sign, also is a demonic changes also we can see in a chest x-ray. So understanding of these two opacity goes a long way to be able to determine what you see in the chest x-ray. This first x-ray here, this is an example of a round pneumonia. You can see the round ball here. You see another one here. So it's suggestive of round pneumonia. So it's easy to pick out if you look closely the chest. You can pick it out. This other one here, we see this opacity. You see how it extended even to the right lung. This is a case of hemorrhagic pneumonia. This was confirmed from the drained fluid. So this other one, you see this lesion here, is an example of a cavity in the chest x-ray. It's described cavitating pneumonia. It's an example of a cavitating pneumonia. You can see this opacity, see the wall is sticking. Then you see the inside, the air inside. That is how cavitating lesion look like in chest x-ray. Then we see this other image here. You see this opacity here. You see this opacity here. Yeah, this shows is pneumonic changes in chest x-ray. So it's an indication of pneumonia. Then this other image, you see this opacity here. Yeah, this one is located at the middle lobe. You can see the diaphragm is clear. This is also pneumonic changes. You also see this other opacity here. Pneumonia is easy to identify in chest x-ray. You see this opacity. It's not a lung collapse because the trachea is still at the center line. So it's a pneumonic changes in the lower part of the lung. Also, it is not pleural effusion because you can see the diaphragm also. And there is no meniscal sign in this place. This other image here is the opacity down here that occupies the lower lobe of the right lung. That is also is a pneumonic changes also. So it's easy to identify in chest radiography. This other image, you see this, if you look closely, you see this round opacity here. This is an example of round pneumonia. So you see, you can easily pick it. You see this other image, you see how the horizontal after is pulled up a little. Then you see the opacity here is a pneumonic change. This other image down here, you see the opacity here is a pneumonic changes. And this chest x-ray, you see a double shadow here. This shadow is a pneumonic change. Oh, I could not get the lateral image. If you do lateral, you will see the shadow well outlined. And this other chest x-ray, you see the highlight enlargement here. You see the highlight enlargement. Then look closely, you will see a thin, not that thick compared to the abscess lesion here. You see the inside contain larger quantity of air compared to what you see in abscess. So this can be late appearance of abscess. That is a nematocele. That is how it look like, where the thickness they keep decreasing and air keep increasing. So that is a nematocele. That is a complication of pneumonia. Thank you so much. Like, share and subscribe to this channel so that you will be notified of new videos. Bye for now.